The other decisions we have to make as a surgeon is what type of mesh are we going to use for hernia repair. I think that when we think about our strategy and our technique for hernia repair, if we're going to place a mesh in the intraperitoneal environment, it needs to be a tissue separating mesh. We've really moved over the last decade away from microporous meshes and more towards macroporous or polypropylene meshes that have a tissue separating absorbable layer. Those meshes tend to have a better profile in terms of tissue incorporation, less contraction of the mesh, and also can be placed in the intraperitoneal environment safely against the viscera. So I think that that's really allowed us to make giant strides in terms of the types of mesh we would use for hernia repair. The other big evolution over the last decade has been the move from heavyweight mesh towards midweight and lighter weight meshes. We have done a number of studies in which we've looked at patient comfort and quality of life comparing heavyweight mesh versus lighter weight meshes. And what we've seen across the board is that midweight and lighter weight meshes tend to be better tolerated by patients. They tend to have less sensation of the mesh, and they tend to have improved abdominal wall physiology. I think that when we try to determine whether or not we're going to use a midweight or a lightweight mesh, that really depends upon the nature of the repair. And in my mind, if I have a patient in whom for some reason I cannot achieve fascial closure over top of the mesh and I'm going to have a mesh bridge, such as a laparoscopic ventral hernia repair or an open ventral hernia repair where I have a large central defect and I know there's going to be lots of pressure on that mesh, I might tend to choose a midweight polypropylene mesh. In a patient who has a smaller defect, perhaps Swiss cheese defects for a laparoscopic case, or in a patient in whom I'm able to achieve fascial closure over top of the mesh, I think that's a patient that it probably makes sense to use a lighter weight mesh in. So that's kind of my algorithm in terms of how I'm going to determine what type of mesh I'd use in a particular patient situation.